Hospice Klang, what we do. Hospice Klang is a non-governmental organization, non-profit, depends largely on public funds to run its services. Hospice Klang was formed in 1996 to provide palliative care to patients with terminal cancer. Our main work is visiting homes to provide care for sick patients at their homes. Our services are provided free of charge. Our hospice center is at Kota Boyu Emas, Klang. What is the area covered by Hospice Klang? Patients in the Klang district, living in the area 10 kilometers around Hospital HTR, we receive referrals from all the major hospitals in the Klang Valley. The majority of patients are from government hospitals and University Hospital, KL. How do patients get registered with Hospice Klang? Patient must be suffering from cancer or end-stage renal failure. Patient must be referred by the attending doctor/hospital. A referral should have all information about the patient. Referral forms are available from our center or downloaded from our website. How do we manage patients? Management of patients is broadly structured into 3 parts. 1. The initial visit. 2. Plan of care. 3. Subsequent home visits. The initial visit, all patients referred are first seen by a nurse or a doctor. Assessment of the patient is done and an ECOG status assigned. The frequency of home visits will largely depend on the severity of illness. The patients more seriously ill are visited more often. Plan of care. Assessments of patients are done at every visit to help formulate a plan of care for each patient. The plan provides for immediate needs. The plan also anticipates future needs. Planning is extremely important for the medical team, which is now proactive, prepared for most foreseeable problems, for patients and families who are now more prepared for what is ahead. Subsequent visits are 1. Routine scheduled visits. 2. Distress response visits. Having a plan of care makes responding to needs easier as we can anticipate needs. At each visit, the needs of the patient, family, are assessed and appropriate treatment given. What kind of care and service is provided? In general, care is needed and given in 4 areas. 1. Treatment of physical symptoms, pain, vomiting, breathlessness. 2. Nursing care, care of feeding tubes, urinary catheter, treatment of bed sores, wound dressing. 3. Education counseling, explaining diagnosis prognosis, teaching nursing care. 4. Loan of medical equipment, wheelchair, hospital bed, mattress.
Can the home-based hospice meet your needs? Questions to ask. 1. What are the various roles represented on your team? 2. What services do you provide to patients in their homes? 3. Do you provide symptom assessment and medication management services? 4. Who sees your patients in their homes? 5. How often does your staff see patients at home? 6. How do you manage pain, and how are prescriptions handled? 7. How do you handle patient emergencies and after-hours calls? 8. How do you communicate with your patients' other doctors, and what is your process for coordinating care? 9. How do you discuss goals of care with your patients? 10. How do you manage patients who are actively dying?